Welcome. My name is Natasha Sherman, and I am your host. And my guest today is Dr. Jenna Tedescho. She is a doctor of clinical psychology, and although she works with a variety of segments of the population, today we're going to talk about one of the areas that's important to her, and that's her work with veterans and PTSD and veterans' families. Welcome.
Thank you so much for having me.
I'm delighted to have you here, and I think what happens is we get very focused on the news. So, we have the opioid epidemic, and then that kind of, we hear it a lot of, every day, and then we tune out. And it's no longer sexy news. And I think sometimes that's what's happened with PTSD. Oh, yeah, another veteran with PTSD. And I know it has a huge impact on the veterans themselves who have given their service and their families and society at large. Yeah. So I wanted to talk about that. So maybe you could just start about why you work with this particular population.
So I work with this population because when I was completing my graduate studies at Widener, I began to work in the community mental health system. And everywhere I looked, the kids in the community there was no way of avoiding trauma right in your face all the time. And so I began, and I cultivated my early years of my professional career treating children and doing a lot of advocacy in and out of court for kids who had experienced trauma. And
I want to mention that PTSD is not just in the veteran population. Kids experience it.
It's endemic. Yeah. And another interesting tidbit is, even if you don't meet the diagnostic criteria for PTSD, it doesn't mean you haven't been impacted by trauma. Trauma can lead to PTSD. It can also lead to depression. It can lead to psychosis. There are all manner of other not so wonderful possibilities.
Right.
So after working with kids, I then started working, doing some consulting with Amnesty International, which led to a lot of work in the Cambodian community, and seeing the impact of horrific trauma within that community really kind of woke me up. And from that point, the universe dropped in my lap the opportunity to go and work at the VA Medical Center in Wilmington, and that cinched it.
Wow.
Yeah.
So let's talk a little bit, let's jump right to it in terms of what is it that we should be watching for in our families or extended families as symptoms that something is really wrong, and we can't just dismiss it as, they experienced X, Y, and Z. What should we be watching for?
That's a huge question with a very complex answer. So I'm not going to do it justice, but what I can say is the first thing to be aware of is avoidance. The hallmark of traumatic stress is avoidance of things that remind you of the stress that originally occurred, talking about it, and so on. And usually that avoidance leads to people having things like flashbacks, because anything you try really hard not to feel or deal with will come right back at you.
Especially something traumatic.
Oh yeah, and nightmares. And flashbacks and nightmares are your brain's way of trying to knit all of these elements of the original traumatic event or events back together so that you have, an integrated and whole and healthy brain. The difficulty is that for most folks, when those things occur, it's really unpleasant. You push it away.
Of course. And I'm going to jump around because we're going to do like little sound bites.
Sure. And that's fine.
So then again, there's stigma attached to mental illness. There's the whole thing about, families being loving and caring, but at some point, if you haven't had the experience, there is this underlying sometimes attitude of just get over it, it's enough, it's 10 years or whatever it is. Not recognizing that PTSD has actually changed the physicality of the brain, that this is not something that you can get over just by wishing it. So what's the impact on the families? Like should they be doing for themselves?
So the first thing is to find ways to take care of oneself and each other, but one's self. You have to water the seeds in yourself first so you have a crop of goodies to offer.
So what would that
out.
look like?
That would look like things like, if you're struggling with trying to figure out, like, how do I talk to my loved one and how do we structure our home? Go see a therapist. Go see somebody who has an expertise in helping out. And, then you lay it all out on the table and you figure out what works as best as it can for every individual.
I think that's very significant, is seeking someone out who is an expert. You can't count on yourself to be an expert or to figure it out.
Yeah.
And so, yes. So
you need a second brain.
Yes, absolutely. And maybe even a third and a fourth.
Maybe. But at least you need two for that one.
Yeah.
Yeah.
And so then there are different methodologies that come into play when you're working with veterans. And I want to talk about one of the things that you like to specialize in is mindfulness. And so one of the things that, ties into the whole thing, talking about the opioid epidemic. So are veterans easily prescribed opioids?
So there was a period of time in history, all right, particularly within the VA system, where I would say that was more rather than less true. Some of that has to do with the fact that pharmaceutical companies would come in with data and say, look, pain is the fifth vital symptom. Any pain is unacceptable. And so the idea and the thinking back then was we just alleviate as much, we push that pain away as much as we possibly can, and we're going to give you these medications to do it.
And we make a lot of money while we do
and
so.
And by the way, thank you very much, we get to make some scratch.
Yes.
Right.
Yes.
So, that was a really bad idea, because life always has pain, life always has suffering, and pain is never just pain anyway. The physical body only accounts for maybe a third of the experience of pain. Yeah. Then you have to start thinking about things like thoughts and the way that the mind and the body connect and how that's experienced. I mean, there's so many variables. But basically, the idea being, you lay out with the family what might be possible. And when it comes to opioids, mindfulness treatment has been something that is shown to diminish people's reliance on those kinds of medications. And I can say from my own personal experience with my veterans, I've taught over 1,500 veterans mindfulness in the context of formal codified mindfulness programs like mindfulness-based stress reduction, which is sort of the gold standard, and then a whole bunch of other fancy stuff I developed over the years for them.
So let's talk about that, because some people don't even know what mindfulness is, or it's you just pay attention or you meditate or something. So let's talk about mindfulness as you're talking about it.
Okay. So as I am defining it, I'm simply talking about something that is a quality of attention. And in this quality of attention, you're paying attention on purpose to what's happening moment by moment by moment by moment. That's really all it is. And we bring certain kind of qualities.
Okay, so I'm going to interrupt you here because I'm going to play devil's advocate.
Play devil's advocate.
And then, we're paying attention moment by moment. So what?
Yes. So what? Whenever you invite yourself to pay attention to one thing, what generally happens is the mind wanders, and wanders pretty fast. So in mindfulness practices, for instance, we usually start either with paying attention to the body or paying attention to the breath as it is felt directly in the body, right? So if I'm sitting here and my eyes are closed and I'm noticing my breath is coming in and my breath is going out, and suddenly I'm kind of having the awareness of the smell of cheeseburgers, and gee, I would really like a cheeseburger for lunch, and I haven't had cheeseburgers in a while, but cheeseburgers aren't so good for you. When I get out in the bushes out here, the minute I realize it, I can go, oh, I'm doing that cheeseburger thing I do. And with kindness, or at least with the intention of kindness, begin to bring myself back to the thing I was sitting with in the first place. This
okay,
is
so I'm going to interject something here. I love this conversation. So I like that, with kindness. And I remember I lived at a yoga center in India, and my teacher saying, when a child runs into the street, you don't beat it. You just take it by the hand and you bring it back. And you don't judge it, whatever. They don't know better. So I get all of that, but, again, on a very practical level, so what?
Here's the so what. Every time you wander and every time you return, it's like doing one repetition with a weight. When you do a repetition with a weight, you build architecture. When you wander and return, your brain changes.
Okay,
Yeah.
and what is the purpose? Why are we trying to make this brain change?
When you experience a traumatic event, your brain instantly shifts and you begin to see the world in a different way. And that leads to your brain being physically different. So a person who's experienced a trauma that's not processed or integrated, if you stick their head in an MRI machine, you're going to see some differences in the amygdala, which is your fight or flight organ. It's the one going danger, Will Robinson. Your hippocampus, which is responsible for things like encoding emotional information and remembering things, particularly spatial things. So like if you forget where your keys are, that's your hippocampus. And the more irritated you get because you can't find your keys, the less your hippocampus works to help you find them.
Okay.
So when you have one traumatic event, changes all this. Mindfulness builds it back.
Okay, and this is what I really want to get to. So your brain does literally change.
Literally
and
changes.
so the whole fight or flight thing is not something we want to continue being in that mode, because that causes stress and that causes all the other stuff that is associated with stress. So we do not want to live in amygdala mode all the time.
Yeah, and it's hard to convince people who've been living there for a long time that it's okay to come back out, because they really do. Folks develop this belief that I have to be hypervigilant. I have to look at every single thing. I have to be on my game at all time, or bad things will happen, because that's been the experience. To ask somebody to come back from that and drop into the moment they're in is real tough.
Yeah, and again, perception trumps reality. So
Definitely.
It's like when your mind has changed and you have this trauma and you're trying to avoid the trauma, so wherever it is your mind, that tunnel with no cheese at the end of it, that your mind is going down, is not usually going to be a good one. So if you can bring it back to the moment, this moment, it's seeing that no clear and present danger.
Right.
So it allows you to be present as opposed to being in all the what ifs.
Yeah. And and the interesting thing, I think, is it becomes not just about sort of turning the volume down on the amygdala, shouting that bad things will happen. There's all this other connectivity that occurs. Trauma, folks who've experienced trauma often try to live a life in the land of the mind. Sometimes pretty much everything from here down is like, I don't know what's going on down here. I don't want to know what's going on down here. So for people to be able to connect with their actual body and feel into the actual safety in any given moment, no matter what the mind is telling you, requires some change in a part of the brain called the insula, which is right here. The insula is, if I were to kind of like stick my hands in like this and go like that, it's right in there. And it has connectedness from here all the way down. Everything. The fact that you can feel the soles of your feet right now is because of your insula. So allowing and cultivating that architecture is a way that people can also come home, particularly, military sexual trauma. For every veteran that I have seen who had, just PTSD, and nobody has just PTSD, but I would say I saw one that suffered from military sexual trauma.
What is that?
Military sexual trauma is when people are harassed or assaulted sexually or on the basis of sexuality in the military. It is
men and women?
Men and women. So the current statistics, I'll quote for you, and then I'll tell you what I suspect the real statistics are. The current statistics are 1 out of every 4 women who have given service in the military has experienced military sexual trauma, and 1 out of every 8 men. Now, that's what the statistics are, but I can count on one hand the women I have met who have served in the armed forces who have not
And
been
let's
traumatized
describe
this
sexual
way.
trauma.
I'm talking...
What's the range? What's the spectrum?
Everything from... well, I'm not sure I understand your question.
When you say these statistics, they've experienced some kind of sexual trauma.
Right.
So what?
I'll give you an example.
Yeah.
For a while, there women coming back from Iraq, for instance, were having these huge issues with their urinary tract health and with kidney infections, because when they were in theater, they would stop drinking water around 3 in the afternoon, because they did not want to have to go to the latrines at night because they were being attacked and raped. That's what I'm talking about.
By their fellow soldiers?
Yes.
Wow.
It's awful. It's awful.
And we see these commercials, be the best that you could be, whatever else. And, it's like one has to kind of question and talk to other people, because it's not a superficial kind of join and everything will be wonderful.
No.
So then what about the men? What does that look like for the men?
It's generally, excuse me, a superior officer, and there's usually some threat, like a lot of threat of, you're going to have terrible, horrible, bad things happen to you. I'm going to, put you in for Article 15. I mean, just crazy stuff. But it's also...
because they're threatening them to have sex with them.
Yes.
Okay.
Yes. Or they're attacked. I've had several male veterans who've had experiences, they're in a submarine and they're targeted, and it's groupthink.
Do you ever want to give up?
No, and I'll tell you why. I will say it with my dying breath, there's meaning in this kind of suffering. And it's a gift to hold people and be able to help them figure out that meaning for them and how their healing path
Could we do with a little
unfolds.
less suffering?
Why, yes. I personally, I think a little less suffering would be nice.
I think the thing that gets to me is, and again, it's a thought, and then I have to let it go. But you can't dwell there. It's just this idea of, we seem to have learned nothing. I mean, children are being molested, adults are being molested. The church covered up tons of molestations. And it's not just the church. You go into other organizations. Now we're talking about the military. What is wrong with us as a species?
Well, what seems to be wrong with us, I think, is grasping. We have this attitude, this belief that we are king and or queen over all the domain, and we somehow therefore we take ownership of reaching out and getting more, and reaching out and getting more, and reaching out and getting more. It makes us great capitalists, but not such great human beings. And the reality is, once you shift that belief a little bit, you can start realizing that in each and every moment, you're already there. The more is right here. Tara Brach talks about being a bird with two wings. Mm-hmm. You put all of the crapola, I like to call it jackassery, if you will, in one hand, because it's there, it doesn't go away. But in the midst of the jackassery, there's also the fact that right now my teeth don't hurt. Right now I had food today.
Yes.
And we overlook this stuff. And one doesn't outweigh the other.
Yeah. It's being able to see both.
With equanimity. Yeah.
Yeah. Well, the equanimity part is the challenge.
Yeah,
and I think,
it is.
On the other hand, and I get that reaching for more, but I think part of it ties into that, and this is where we go back to mindfulness, is that we keep thinking that what is going to fill this is out there.
Bingo.
And we're not taught to think differently in this culture.
Absolutely.
So, again, an advertisement and society and everything else, just keeps out there, more of this, more of that. And so, and if you feel good, well, you got to add this in order to make it even more.
Is it good enough?
Yes.
When is it
so
good
I
enough?
think the whole concept of mindfulness is tied in also, at least my interpretation is, it's being with what's inside. So it's, if you could just be present, like you say, in this moment, nobody's threatening our lives.
Right.
We're not starving. And then we don't even have to look at it in relationship to suffering. It's like, oh my God, here I am on this journey of life, and kind of embracing it. But we're not trained to look inward where everything exists and where all the kind of real gold is.
Yeah. No, I agree 100%. I think that there's this idea that somehow if we keep reaching outside of ourselves, we will find the answer. As a psychologist, I think of myself as a Sherpa. Mm-hmm. I call myself a mental health Sherpa because my intention is to help folks to walk their journey and to help them carry a little of the load, until
so
they're
say a
ready
little
to
more
take
about
it.
that.
About which piece?
Well, when you talk about, their journey, so we're not, part of the journey is wanting to reach for that and being a part of a society that encourages to reach for that. So for me, it's like when you're talking about their journey, well, partly, as someone suffering from PTSD of any sort wants to escape. So it's like, okay, let's bring you back. Let's get you to a place where you can see that you're actually safe and can be safe and can stop being vigilant. But then how do you, so that's part of the journey, but the end game, what's the end game? It's like,
the end game is whatever you resist persists. And that means that if you are trying really hard not to feel the feelings that are arising in your body and in your mind, they will most definitely come back louder and more obnoxiously in all likelihood as you desperately clamor for yet another thing to fill the hole, make it okay.
And put yourself in debt.
And make yourself nuts with it. Mm-hmm. If you can, and I think that it requires, again, a second brain. You need a second brain to do this work with you because you need someone to bear witness. Yeah. If you can begin to allow yourself to sit with even the stuff that's awful, you have a hope. And it doesn't mean, there's a saying, feeding yourself to the lions. I tell my patients, look, sit with this discomfort for as long as you are able to stay friendly with it, noticing when it starts to get kind of ugly.
Right.
And when you get up to that edge, notice where that edge is. And if you need to, open yourself back up to something else. Yeah. But there's a process of approaching and then leaning back and then leaning
and being in
in
charge of your safety.
Absolutely.
But being willing to do that. And I think, we're almost out of time, but one of the things I really think is, all we're longing for, all of us, at the heart of it, is connection.
Bingo.
And feeling loved and cared about. And then what we don't notice is that there are people we can reach out to. And so even if it's not someone in your personal life, there are professionals, there are experts, there are groups. It's really making people realize that there is something out there that can alter this for you.
Yeah.
And to keep reaching for it.
There is absolutely hope. There is healing. There is growth. There is taking all of this crap, digging it into the soil, and then seeing the amazing things that can come next. You don't have to do it by yourself. And in fact, you shouldn't do it by yourself.
Right. I think that's significant.
I don't think you can. Yeah. Maybe you can. I don't know. I don't know everything.
And we're not here to be by ourselves. So
no, we are. Listen, there is this wonderful thing called interbeing. The mirror neurons in the back of my brain communicate with the mirror neurons in the back of your brain. We're just now beginning to understand the physics of interbeing and how it is that we connect with each other. How it is that when a kid in California has a car accident, the mother in Hawaii knows it.
Yes. And we are at the end of our time, but I love ending on that note. And I just wanted to reaffirm that the fact that the brain has changed doesn't mean it will stay that way forever, that it can be rewired and that there is hope.
Absolutely.
Thank you so much for being here, and
thank you
for the work that you do.
Oh, thank you so much. And I express my deepest gratitude and appreciation to all of the veterans who have welcomed me into their lives and their hearts to be of service.
Yeah, thank you. My name is Natasha Sherman. Thank you for joining us.